welcome everybody to today's webinar. I'm Dr. Hugh Harvey from Hygiene Health, and I'll be the moderator today of our session, which is a radiographer's perspective on artificial intelligence. And I'm delighted to be joined by two extremely proficient, intelligent and charming radiographers today, who confusingly are also called doctor because they both have PhDs as well. So please welcome Dr. Christina Malametanu. I can never say that quite right. I'm very, very sorry. And Dr. Andrew England. Please, Christina, just briefly introduce yourself to our audience. Tell them who you are, what you do, and your interest as a radiographer in AI.
Thanks, Hugh. I work as the director of the postgraduate program in radiography at City University of London. I'm also in charge of the PhD program, currently the chair of the AI advisory group, in the past also the working group of the Society and College of Radiographers. I'm the lead for the module on AI for radiographers at City University of London, and I was also recently elected as a member of the USOMI board. My interest in AI started with my PhD exactly 20 years ago. I was working in an algorithm with a multidisciplinary team of clinicians, computer scientists, mathematicians, all clever guys, to develop an algorithm for motion correction in fetal MRI. So my work was more on the data collection and validation afterwards. Once I left that role, I worked much more into an academic role as a lecturer, senior lecturer, going up all the levels in academia, and I now work more on AI education, AI governance, and the impact of AI on careers and professional identities for radiographers. All of these are important elements for AI adoption, and I am in this domain because I believe AI is great, but we have to work to harness its full potential and mitigate risks.
It's a really impressive CV and 20 years of experience in the field, and you're still going. So we'll dig more into some of your experiences and your learnings over the decades. But next up is Dr. Andrew England. Andrew, please do introduce yourself to the audience and speak a little bit about your experience with artificial intelligence.
Thank you, and thank you for the great introduction, obviously, Cure AI, for the opportunity to speak. So I guess I sit here with perhaps two hats on. I'm a senior lecturer in radiography at University College Cork in Ireland, and I guess most of you probably with the accent think that actually that's not an Irish accent. I spent an awful lot of time working as a diagnostic radiographer in the UK, but also a radiography academic in the UK. But I also am sitting here as the newly elected president of the European Federation of Radiographer Societies. And that represents around 100,000 radiographers across Europe, around about 8,000 students. And really, it's the European kind of collective professional body for our national society. So depending on which country in Europe, you'll generally have a national society, and there's a good chance that it will be part of the FRS. And really, I guess my interest in AI is twofold. I'm still a clinically practicing radiographer, so I guess that I'm obviously keen that we embrace the very latest technologies that allow us to deliver the most efficient and optimum patient care. And I guess as a radiography educator and part of a professional body, it's how we implement this, how we train it. Christina's just mentioned about training and how we do it correctly, really, so we benefit from these technologies, appropriately.
Thank you so much, Andrew. So for the audience today, we do like to make these webinars and sessions interactive. There's a chat function, so please put your questions in. They'll appear in the chat box, and I'll pick out those worthy of our panelists today. As you can see, I think we've picked two of the top radiographers, if not in the UK, definitely across Europe as well. And I'm quite excited to find out their thoughts and feelings on AI. But what I wanted to do is start and take a step back, especially for those members of our audience watching today and on the recording later, who maybe don't appreciate the nuanced difference between radiographers and radiologists, because they are a symbiotic relationship of professional bodies. Radiologists simply cannot do their job without radiographers. So perhaps, Andrew, do you want to address how you see the differences between the two professions? And then Christina, we can move to you and how we see them working so symbiotically together.
Yeah, no, absolutely. Thank you for the question. It's a question that we're often asked quite often. How does the role of the radiographer differ from that of a radiologist? So if I take radiologists, first of all, they will have had a medical degree and they will have undergone postgraduate training in radiology. And primarily that's around image interpretation, but also with the clinical elements that come with that. The radiographer, the role of the radiographer is more focused around image acquisition, so acquiring the X-rays, the CT, the MRI scans. But in many areas around Europe, particularly the UK, that's also evolved, advanced into image interpretation. So you'll see many radiographers in the UK that were reporting chest X-rays, reporting skeletal X-ray examinations. But the big difference really is the fact that radiologists have had the medical training and largely they're responsible for the image interpretation in terms of the more advanced imaging modalities.
And Christina, how do these two professions work together typically?
I think there are many synergies between radiologists and radiographers. Actually, they form part of the wider ecosystem of medical imaging, which is also, comprises of medical physicists. There are many other people around. So these two professions work harmoniously in, the addressing everyday clinical workflow. And like Andrew explained, we are more on the driving seat of the equipment, MRI, CT, X-rays. Sonographers are also doing the ultrasounds. And then we work with the radiologists to ensure that, first of all, our patients are safe. This is one of the three pillars, I think, of our service. Secondly, we produce the best possible image quality for the radiologist to interpret. And we are also working with patients to ensure the optimal patient experience and patient care.
So that's the essential differences in modern practice. Are we seeing these two becoming more collaborative as time goes on? And I particularly reference what Andrew said. In the UK, some radiographers are now doing advanced reporting. Or they become advanced practitioners, I think the term is. So Andrew, how does that look in the UK and how does that compare across Europe? Because you said that you're president of several European radiographer societies as well.
Yeah, no, absolutely. So certainly in the UK, we've seen advanced practice for radiographers, and that's moved in perhaps some of the areas where there were workforce shortages. So particularly in sort of skeletal and chest radiography reporting. And again, at the same time, that's come over perhaps the last 20 or 30 years that we've seen, that trend of advanced practice growing. And that's allowed radiologists to move to, I guess, share more of their expertise in the specialist areas. So I think when you ask the question really about collaborative working, I think we're at a real point where we're doing this, very, very well, almost potentially a showcase for other professions around the world. Radiographers and radiologists with the other professions that make up the radiology family working together, we've seen great advances. Now, you're absolutely right. We've seen differences in how that's done across Europe. Certainly, there are parts of Europe depending on how healthcare is funded, but also, I guess, differences in the workforce. Some countries have greater shortage of radiologists. Some might have a greater shortage of radiographers. So whilst we're seeing some evidence of advanced practice across Europe, I guess a lot of places turn to the UK, maybe parts of Ireland, to maybe see where the direction that's going. And certainly in the UK, maybe over the past 10 years, with perhaps some of like the key white papers, we've seen some real growth in that area.
So you're not adopting the advanced practitioners at the same scale that the UK has to date?
I would say, yeah, definitely. If we compare like for like now, there are some key differences. I guess there is an appetite among some countries to push the advanced practice route quicker. So Ireland, I guess, we're at a key point where that potentially will start to take off with more speed. Other parts of Europe, and I think we've got to remember as well that radiography training across Europe is highly variable. There are some 2-year courses, 3 and 4-year courses. Some are university degrees, some are college-based training, some are even in-house training. So we're not necessarily at a point where the radiographer is necessarily the same thing across Europe, but that's one of the roles of the organisation that I represent, is about harmonisation, that we want to get radiography recognised the same across Europe, but also the standards of education the same.
I believe we've...
Sorry.
I bet we lost you there for a minute, Andrew. Do you want to complete that last sentence again?
Yeah, just to say that we want to get the standards of radiography education comparable across Europe. And one of the key things is we want to look at how AI will sit within that. Training for AI is going to be critical in getting effective implementation.
Yeah, and I like to pick up on that analogy you made. There's a radiology family. With radiologists, radiographers, medical physicists, but also the allied healthcare professionals who help as well in the department. So it's not just a two speciality team. It's multidisciplinary, isn't it? And now we have a new member of the family being launched upon us, don't we, Christina? Well, I say new, but you've been doing it for 20 years. So I think my first question to you is, what have been the main advances in artificial intelligence since you first dipped your toes in these waters?
Well, I guess the most important thing that brought AI from the lab to the clinic is the speed, the processing speed of the computers that we have. I do remember 20 years ago that to run one algorithm over one data set of fetal MRI, it was taking about 8 days to produce the results. And now, 20 years after that, it takes just under 15 minutes. So it can recreate the image, it can, reconstruct the images in real time, in effect, yes? So you do the fetal MRI scan, then you have images in 15 minutes or under 15 minutes. So that's one of the big things. I guess the other revolution that happened, and this is on what AI feeds on, the algorithms are feeding on data. So in the last 20 years, we went, before the AI revolution in clinical practice, we went through the big data era. Like 7-8 years ago, all the conferences were about big data, in all the sessions. And now we are all AI. So I think big data and the digitalization of healthcare created another very useful condition to advance AI implementation. And the final thing that is really important in the last so many years are the advancements in neuroscience that helped neuroscientists understand how the brain learns. And that learning became the basis for machine learning and deep learning. So I think these three advancements, technological advancements, helped a lot in the progress of AI. And we can see that progress in the number of publications, because research precedes practice. So in the last 10 years, the growth of AI-related publications, particularly in radiology, which makes up more than 50% of these publications, has been phenomenal, absolutely exponential.
It has, and I think you're very right that the big data phenomenon, the introduction of digitization and PACS systems, has left us with this lovely data-rich substrate on which to build these AI systems on. And judging by at least this week's news, AI is just progressing at an exponential scale in terms of performance. But it does take time to translate clinically, as you quite rightly pointed out. So now we've covered sort of the main difference between radiographers and radiologists, and a little bit about the environment in which we work, and now talking about AI being applied to it. And again, for the benefit of our audience, AI is a very generic term. It describes a lot of different types of software with a lot of different intended use cases. So can you speak to sort of what we're seeing in radiology AI in terms of clinical use cases? And how do we break that down into what might be useful for a radiologist versus what might be useful for a radiographer? Andrew, do you have any thoughts on that?
Yeah, I think that's perhaps a really good categorization, though, if we think about what might be, of benefit to the different professions. And then that's perhaps key in us moving forward, is identifying those unmet needs. So I guess when we go back to our core roles, if you think of the majority of a radiographer's time will be spent with image acquisition. So we're seeing roles in AI in terms of potentially justification of requests, scheduling, optimizing scheduling. We know that radiology is growing, so we've got all of these requests coming through, and how do we prioritize? How do we optimize work lists each day so we get the maximum efficiency from our scanners? But at the same time, with image acquisition, scanners, if we take CT and MR, are becoming more and more complex. And AI has provided an opportunity to allow us to optimize these examinations, delivering individualized patient care, which I guess is, we know from the literature that, delivers better outputs. So in terms of, dose optimization, we've seen AI, working in this area. Perhaps a big area of growth is, we know that MR scanning is, by its nature, tends to have relatively long acquisition times, and AI is being used to help reduce some of those scan times. That allows us to offer it to different patient types, but at the same time potentially allowing us to increase capacity. So those are the areas really I think are around clinical workflow, in terms of making it more efficient, allowing us to do more and use all of these features that are available on the imaging equipment that often sometimes we may not fully understand or have time to apply. And then the second one I think is really around kind of the diagnostic side, which for radiographers, that's there are emerging reports, there are systems out there which can help in terms of identifying pathology, classifying pathology, potentially acting as a second reader. But I guess some of those examples also spill across to what radiologists would be using within their practice. So I think some people might think when we talk about AI, it's these things like, pathology identification, maybe pathology classification, but AI is a much, much bigger arena for the radiographer. And if we think about it helping improve our efficiency, that's what one of our primary aims, as Christina said, to do things safely. But we have got very fixed resources at times. We'd like to image more people, and we know that waiting lists are growing. And I believe that AI can provide a real vehicle to help us, achieve kind of more with what we've got, rather than us automatically thinking I need a new scanner, or I need to build an extension to our radiology department.
Yeah, so there's almost a quite clear distinction there between the utility for radiographers versus radiologists, but also that area of overlap that you mentioned, which is, can an AI plus a radiographer provide a safe and effective, if not triage, but potentially in the future diagnostic service as well, equating to the performance of a radiologist? It's a controversial topic. I'm not by no means suggesting we're there yet. But Christina, you've been doing some research into people's thoughts and feelings, and you've recently conducted a survey through the university affiliation. Do you want to describe for our audience, what that survey was setting out to assess, and if you can, speak to some of the results?
Of course, thank you. Thanks for the opportunity to speak about this survey. So there have been different areas we have examined. So there's been a survey that was published in 2021, and there's been a recent survey about AI governance. Would you like me to speak about both? The first one is more generic in the UK.
Let's just talk about the generic one first. Yeah.
Yes, excellent. So the first one was published in 2021 in Frontiers in Digital Health, and it was about all the factors beyond the technical factors. So we launched the survey online, and we had more than 450 responses. It was a multidisciplinary team, and many radiographers from our AI advisory and working group in the society and college. In the responses, overwhelmingly, the results were that the radiographers don't know enough about AI. Overwhelmingly, they said they don't know enough, they don't have enough knowledge. If they did, it was quite generic. Also, they felt that there was not enough training directed at radiographers for AI, and most of them had to educate themselves on some online, resources that were not necessarily academically sound or were not necessarily accredited by professional bodies, didn't have necessarily all the information they needed. Some other results, which are very, very important, were that there were some differences when it came to confidence in working with AI and demographics. So, radiography is a female dominated profession. 3 out of 4 are women in the UK. I can speak about the UK because we had to examine all of that. In our sample size of 450, plus radiographers, women overwhelmingly said they don't feel confident enough to work with AI. And this is significant if you consider the proportion of women in our workforce. And also, the younger radiographers, so the ones who were fewer years in the profession, they felt more confident in working with AI, and those with higher degrees also more confident. So masters and PhDs from that subgroup. I think these were the major results from that survey. I cannot hypothesize about the reasons why there were these differences, but certainly these give us some guidance or some food for thought for how we design the training in the future for radiographers. Would you like me to speak about the other survey, Hugh, the one we have done with a larger group of people?
Absolutely. I gather it's not published yet, but you've submitted, is that right?
Not, yes, but I'm very happy to speak about it. So we have worked with many key stakeholders around, the AI ecosystem. I don't know if I'm allowed to say all the names here or not.
Yes, of course.
That's fine, great. So we had the 3 major professional bodies. We had the Society and College of Radiographers, who also funded this research. We had the British Institute of Radiology and the IPM, the Institute of Physics and Engineering in Medicine, and we also had the reps from these groups. So we had Dr. Tracy Regan, we had Dr. Amrita Kumar, and we also had Dr. Anna Barnes. We also partnered with UCC in Cork with Professor Mark McEntee and with AIinHealth, who very kindly offered their time pro bono to advise on all the important issues when it comes to regulation and governance. And this survey was open for 2 months at the end of 2022. And we did it only in the UK again, because for us it's important to understand the context in one country, because there are so many confounding factors when you try to do on a European level before you've done it in one country. And data was analyzed, and we just submitted a couple of weeks ago in a journal, and we hope to get some more news on that. But I can share some results as the PI. What this proves is that the different groups within the AI ecosystem, so radiologists, radiographers, and medical physicists, are equally anxious about the future for AI, equally excited because they want to work with it. Although there are different opinions in there, the overwhelming opinion they're excited about AI implementation, and also in terms of the priorities they see for implementation, they have all stressed that they want more training and they want more standards and guidance to come out. To audit AI, to be able to monitor AI. Incidentally, I have also worked with the British Standards Institute, and I know there are many, many other standards, ready to launch or have launched recently. And there will be something coming out this April in terms of auditing AI in healthcare.
It's fantastic. Can I pull out a couple of threads there? The first survey you spoke about, there seems to be a gender and an age difference in their thoughts and feelings around AI. And I was unaware, obviously, of the gender difference in the workforce anyway, so that's a very interesting point. I think the age makes sense because I think the younger you are, potentially the more tech savvy you are, the more risky you are as a younger person potentially. Um, so maybe that kind of explains it, but I suppose you didn't dig into the details. But then that does lead straight into the finding from your second survey, which shows that people want more education. So I guess the question is to both of you, what do we see as being the important things to include in a radiographer's training curriculum now? Seeing as AI hasn't quite arrived into wide mainstream clinical practice, what should we be training the future radiography workforce exactly on? Maybe Andrew would like to start.
Can I add? I think there's lots of considerations, I guess, into thinking about how AI would fit in training. And I think one thing to consider is, I guess, with the growing number of imaging modalities, I guess the growing number of diseases that we're asked to image, that the radiography training curriculum is pretty packed in any case. So there's obviously a challenge in thinking about how we can effectively deliver an AI component. But I think we've got to, really sort of take the lead in the fact that this is something that needs to be a really fundamental component. And I know Christina's done a lot of work around AI education at a postgraduate level. So we need to think about really, I guess, what recommendations in terms of what the curriculum would look like, what the content. And you're absolutely right, I guess, what does that actually mean? It's not necessarily a lecture that says this is kind of AI, these are the terms you may hear. But I think from Christina's research, some of the issues are really around about the fear of the unknown. We've got this technology that's rapidly evolving. It's in popular media all the time. We're hearing about AI in different avenues of daily life, and we perhaps don't really understand what it will mean. And I guess there are some kind of whispers out there about, does that mean that we won't be doing the same role? Will they need less of us, or will we be doing something different? So I think it's important, obviously, we clarify what AI is, but potentially the benefits. But also, as Christina has said, we need, as radiographers, if we're using this as part of daily practice, there'll be some governance issues. Certainly explaining to the patients, as it becomes more part of our daily lives, patients will be asking, is my mammogram, is AI involved in the, interpretation? What does that mean? And I guess with any new technology, there are obviously, people who are very pro, and there are obviously some people who are a little bit more cautious. So it's about offering that explanation, but knowing the strengths and limitations. So when it's right to use something, or a particular patient group where we may need a little bit more caution. But I think the overriding message that I want to give is this is something that we need to do perhaps urgently, because these technologies are out there in different settings. Some are being used, some are about to be used. So it's not something that we wait for somebody else to do 10 years down the line. This is something we need to address relatively urgently, because I think we're all in this role as radiologists, radiographers, really to maximize patient care. And I strongly believe AI can give an extra dimension to that. But to do that, we've got to be able to implement it and use it effectively. And I think education's key to that.
There's a question in the chat, which I'm going to address now rather than wait to the end, because I think it leads quite nicely on from what we've been discussing. Is that do the experts on the panel believe that the role of the radiographer is expanding with the backing of AI? Currently, I want to sort of put that into two time frames. Is it currently expanding because of AI, or do we think it will expand with AI in the future? Perhaps Christina would like to address that.
Yeah, I think the uptake of AI in different modalities is very different. So it's not, I cannot give you one answer. So MRI, CT, mammographies, X-rays, chest X-rays, they have the highest uptake. Or if you want the highest launch of AI-enabled tools, and other modalities not so. There's also a variation between university hospitals and DGH hospitals. So I don't think there's an easy answer to that. What I can say is that at the moment, we are at a transitional phase. We do try to dip our feet into AI. I would love to be able to say we are doing it. We're not doing it yet. I think this is the stage, the phase where we start to become a bit more serious about it. there is not perhaps the enthusiasm that was 5 years ago, and this is seen by the applications submitted for for new AI tools. They're dropping, but I think those who are proceeding, they're a bit more serious. So when it comes to the role of radiographers at the moment, I think we're trying to make sense of what AI means for our practice. There are not drastic changes at the moment, but I think there will have to be in the future. These changes cannot occur without learning and training. The people who won't get training or education on AI, they will be left behind. There's not a better say about AI and roles than the one of Kurt Langholtz. That, and I'm going to paraphrase that for radiographers, but he said it for radiologists. That AI is not going to replace radiographers or radiologists. Those radiographers or radiologists who know about AI are going to replace the ones who don't. And there will be many new roles coming out from AI. There will be things about auditing, about quality control, quality assurance, validation, evaluation of AI. Like Andrew said, explaining. There will be a lot of ambassadorial roles to not only the patients but also to other healthcare practitioners who haven't had the time to adjust. I think as front runners in radiology and radiography, we have a huge responsibility to communicate and to get it right, because there are many other clinical practitioners that are going to follow, and we need to set a nice example that they can follow. When it comes to the roles, therefore, I think that it will certainly reshuffle all the cards in clinical practice, but those who will get the education, they will be the knowledgeable ones, they are the ones who are going to lead it. If I can make a quick comment about education here, if you don't mind.
Sure.
When it comes to the content, I would like to say we can go into advanced things. But actually, the reality says, from the surveys, not only my survey, the surveys that have happened around the world, not only for radiographers, but also for radiologists, we need to be able to understand the basics before we get a bigger bite of AI. And I think we don't get the basics yet. So the basics would be some basic terminology about how AI works, how it integrates with our practice, with some applications in the different modalities or the different subspecialties in radiology. I think there is a very strong case for industry and academic collaborations to achieve that, because technology flies so fast that one academic cannot grasp the advancements that happen every day on a regular basis. Also, a huge thing is ethics and governance, acceptability by healthcare practitioners, and all the psychology of people behind explaining AI, the importance of artificial intelligence for workflows, and also we need to be discussing more about how we can create the latest, the new evidence base to propel our practice. There have been some lovely courses by professional bodies out there. If I can speak about these things, I mean, I know the BIR is creating, as we speak, a really amazing resource, online resource for the multidisciplinary teams. The ESR Masterclass has just been launched, which looks absolutely amazing, and it was led by Professor Alma Cotter and Professor Sotirios Bizdas, and a huge team at USOMI. And of course, there are different courses, like data science courses around the country, and more so happening as we speak around Europe. So I think this is very encouraging. We need to have as many as we can accommodate, because this is the only way forward.
It was a fascinating answer to the question. So I guess the role of the radiographer will be expanding, and probably in ways that we hadn't envisaged. I mean, you've touched on the role of being an ambassador, because the radiographers are the patient-facing side of radiology, so explain to patients where AI is impacting their care, but also being as masters of a new tool. It's a new set of software and equipment and tooling that radiographers can use to enhance their practice. I'm wondering, is there a part of radiography practice that you don't think will be impacted by AI? Because obviously it's only software, it can't do physical things. So clearly there's bits of the radiography profession that won't be impacted as much, and I thought it's important to highlight those just as much as the areas that it will impact. Andrew?
Yeah, I guess one of the areas that perhaps I'm concerned, there are people out there that have suggested that AI is going to give radiographers more direct contact time with patients, and I guess I'm not so sure that is maybe going to be the way perhaps it's being portrayed. And the reason why I say that, if you think of most, most of the high frequency radiology exams are very short patient encounters. So to bring in AI and think that's going to give you a significant advantage in terms of the time, if you think about a chest X-ray, which in the most cases is probably less than a minute, maybe several minutes. So whilst it's going to improve efficiencies without a doubt, the opportunities in things like in more time with patients, we've got to be very, very careful with that, because that's something we'd love to do. We often say as radiographers we don't get sufficient time with our patients. We don't get to know our patients in a way that other healthcare professionals do. But at the same time, demand is growing. We're asked to do more imaging with less people, less radiographers. There is a radiographer shortage, not only in the UK, across Europe and even globally. So we're asked to do more with less, and AI will give us an advantage there. We have got to be protective as well, in terms of that patient care is paramount to what we do. So we should always look at the opportunity to give patients, adequate time, and that will vary on a patient by patient basis. But I wonder that idea of if we're thinking about auto prescriptions in terms of the setup of equipment, that's going to give you more time. I think it will, but maybe not a substantial amount. It'd be more about thinking about how that might look over a week or a month in terms of allowing us to do extra examinations.
Yeah, in my experience in clinical practice, any free time that appears quickly gets absorbed by more work that is waiting to do. So yeah, I agree with that statement that perhaps the promises of freeing up time will not come to fruition, but instead we'll be just doing more work in shorter amounts of time. Do you agree, Christina?
I want to add something here. I mean, I had many thoughts while Andrew was answering. One thing that I would like to say is we have had the privilege of being in touch with patients, yes, of communicating. This doesn't mean the radiologists should not have that privilege. I think very often the radiologists write their reports. They don't have the time to explain it. And I think very often the patient, I know that from friends who call me when they get a report, and they ask me to explain the jargon, I know people would really value to speak with the person who writes the reports in a way that this report is going to be explained to them in simple terms. I do also think that there is one thing probably that won't be replaced by AI, although AI surprises us in ways we cannot predict. I think it's the verbal communication. I think it's this human touch element that I don't think AI can do. But all the other things, there are already ways by which AI is coming into the picture. For instance, patient positioning. With CT scans, the AI-enabled patient positioning has proven much more accurate than the radiographers. And we want that. So yes, we want the best positioning for the patients, for the best imaging and the best experience. So I think this is the area probably that won't be affected by AI. It's the human touch, and this nothing can be substituted in that respect. But everything else, hopefully, will be somehow enhanced by AI.
So you touched on there the importance of communicating results to patients. I think we're seeing with all the modern language models that are coming out over the past few weeks that there's potential there to translate things into lay language, but then also question and ask, what does that mean? Which I think is quite an important thing. Certainly as a trained radiologist, my entire family and friends always send me their scan reports and say, what does this mean? And it takes someone who understands both the clinical and the radiological language to be able to translate it. So huge potential for AI there. But we haven't got any products yet that I'm aware of that are offering that. So I wanted to move now on to without mentioning specific vendor or brands, are there any specific types of AI that are radiographer focused that you're particularly interested in or see great potential for, Andrew?
Yeah, I guess the two arms are obviously the clinical workflow in terms of the actual acquisition and obviously the diagnostics. And if I take the acquisition, I guess the two sides there is particularly patient safety, which we know is of paramount importance, and we're working, largely in with ionizing radiation, which has the risks that we well know. So I think dose optimization is a big one there. That scanners are more complex. The range of scans we have available is growing. Many hospitals have equipment from different vendors. So for a radiographer to know each manufacturer of a CT scanner is going to become challenging. And if you think of all those factors that we're trying to take in terms of what's the clinical question, patient size, cardiac function, if contrast is being administered, it's an enormous set of variables to tailor to the individual patient. And I strongly believe that we do a great job at the moment of trying to take all of those, trying to juggle all those balls and get the best possible output. But with AI, that can allow us to take into consideration more and more factors so that we can truly individualize patient care. So I'm excited, about that. Some of the things in terms of like auto positioning, in CT, getting the isosensor correct, which obviously has dose, implications. Cutting down, the dose and using deep learning maybe to help with reconstructions. Again, I'm a massive advocate of CT has had so much potential, but we have to use it, very, very safely. And if we can reduce the dose, that allows us potentially to take on, new patient types, use it for new clinical applications. And I guess the other side is perhaps the diagnostics. And to me, as I suppose, a clinical radiographer that really has spent a lot of time working in the general X-ray department, it's the potential of some of those sort of diagnostic options at the point of care. So, for instance, you may be doing a mobile chest X-ray within the emergency department or on the intensive care, and the option may be to flag, significant abnormalities, but not necessarily to just be able to do that, to be an advocate for that technology so that you may be working with some of the junior doctors or junior members of the clinical team to make sure that they're aware of those options, but they're using them safely. And again, that you understand maybe the strengths and limitations. So it's not that idea of most people can spot maybe the major complications or the major pathologies, but it's about being an advocate for the technology and making sure that it's used correctly in healthcare, not that it just sits there. And the only time you hear about it is when somebody said, "I wish we had used that," because it would have speeded up diagnosis, reduced the chance of a complication, stopped an unnecessary admission, or we admitted the right patient for the right reason. And I guess we're going to be under an awful lot of pressure to do that. Hospitals, as we know throughout the world, are incredibly busy. In the UK, we've seen media reports about, ambulances waiting, outside to A&E departments being full. And we've got to be very, very selective in how we deliver the best healthcare. And that's why I think AI can be really helpful in saying, these are the patients that we may need to treat more urgently. These are the ones that maybe need to be admitted. These are the patients that potentially could be managed, in the home environment, which is maybe a bit non-traditional. If you had a patient normally, you'd admit them and you'd manage them, whereas actually lots of people can be managed safely at home, with the right care.
So yeah, to two sides to it. The acquisition side, where we can get faster, safer, more tailored imaging of good quality. And then the second side is the touching into the diagnostic side. The old red dot, and for those who don't know, the red dot used to be a physical red sticker that radiographers would stick on an X-ray, but now we have digital. It's no longer red, it's no longer a dot. In fact, it's often a piece of text saying, or an arrow, or something descriptive to say what they think it is. Christina, are you excited about any particular application for radiographers?
Well, as an academic, I'm excited for the academic perspectives and ChatGPT. Some people say, we have to take some measures. I say, let's use it. It's an amazing resource and a tool we can certainly use for further education. Also, I'm excited not just about the tools that will speak about AI, but also I'm excited about the teaching tools that will be working with AI for adaptive learning. And there are some amazing tools out there. I cannot obviously say names, but there are some amazing tools for teaching both radiographers and radiologists for reporting. I think one thing we forgot, and one thing that came very strongly, Hugh, out of the survey, is that AI is creating ripples in radiotherapy. And in our profession, I know this is not a diagnostic element, but as radiographers, we have the diagnostic and we have the therapeutic. And there is huge potential for dose optimization in radiotherapy to get it accurate, to get it right, to reduce it when needed or when able to. So I think this is another area that is really working towards the battle against cancer. So I think this is another area that I feel very excited about the accuracy and the precision AI is going to bring. I think all the other topics Andrew has covered adequately.
Are you talking about contouring for radiotherapy planning?
Exactly. Yeah.
Because that takes hours, and often radiographers spend hours drawing lines around black and white pixels. I can't imagine a worse job to do, and I think people will be very excited for AI to do it.
A very important one as well. So I think it's critical for the treatment. So I think if someone can have assistance on that to reduce that time, would be really amazing. And there are many more things that come all the way. There are many things we can see into the future. Like Andrew said, the requests for imaging examinations are increasing about 10% every year. It's going crazy. And at the same time, after the pandemic, we are seeing a massive exodus of healthcare professionals from radiology and radiography. And this doesn't really add up. I think what is really important is to use AI in really innovative ways. One of the ways might be to ensure staff well-being. So, for instance, their shifts can be calculated or planned based on their, profile, on who they are, what are their family circumstances, what are their beliefs. And then we can ensure that they get this very much sought after work-life balance. So we can give also our healthcare professionals a better future with AI. They can see the impact directly on them.
That's a great point. I hadn't thought of that. AI to make rotas more efficient and introduce a better work-life balance. If people have dietary, religious, or other needs, to be able to incorporate those into their working days. But not just, for the professionals in the hospital, for the patients as well. Book scans at a time that perhaps suits those people better. For working parents, they want to come during the day while the kids are at school, or for younger people, they might want to come later at night after school. So,
or neurodivergent people. Yes.
Yeah. There's a question here. We're going to move to some questions now. So those of you watching, please do submit your questions. We're going to ask what Barbara has put in the chat. Which digital skills do you think therapeutic radiographers should have or develop in order to efficiently use AI solutions? I'm going to split that into two questions. What is a therapeutic radiographer, Andrew? And then what digital skills do you think they might need?
Okay, yeah, no, thank you. So therapeutic radiographers work in radiation therapy. So predominantly they are involved in treating cancer. So radiography as a profession is largely split into two areas. So diagnostic, where you're obviously producing the images to provide a diagnosis and to implement management, and radiotherapy, radiation therapy, or therapeutic radiography, there are a few different terms, is involved in treatments using radiation. Again, in some parts of Europe, just to give a bit of context, they are very separate in terms of separate training schemes. So you may do 3 years training to be a therapeutic radiographer, or 3 years to be a diagnostic. In some parts of the world, it's a combined course. So when you qualify, you could, as part of your rotation, you could do both. So maybe a week in one and a week in the other, or you can make a decision about which job you want to go for, and you could then decide to go in one area or the other. Now, in terms of digital skills, I guess all arms of radiography over the past 10 years have become very effective in the digital skills. All of our images are digital now. We don't see people, carrying bags of x-rays anymore or scans. We don't see viewing boxes in the department as we once did. Again, I think that the skills that therapeutic radiographers need to acquire are the same as diagnostics in a way, that we need to first understand the technology, so we're not afraid of it. There are no misconceptions. We need to then think about how we can explain that to our students, our patients, but also how we can, effectively implement these technologies. And really, it's about, I guess, understanding unmet needs. That there are examples that Christina and I have both said, on the panel today, where there's almost an unmet need. And you said about contouring. I guess that in radiotherapy, that's potentially a big one. If AI can help with that process, patient positioning could be another. But if I could just say two very brief ones where I think we've perhaps not had a chance to talk this afternoon. And one is maybe about patient literature and about whether AI could help tailor patient literature. In radiotherapy, which we, in my institution, we teach as well as diagnostic, often patients obviously want the correct information provision, and it's often difficult to get that right, depending on the type of cancer, the stage, the health literacy of the patient, and lots of other factors. So, having one kind of, guidebook or one video, it, won't fit everybody. And if AI could help in terms of, on a patient by patient basis, almost develop, appropriate literature for that patient, then, health literature has been heavily linked with outcomes. And the other area is training. Just one example is, if you think about radiology training, but in terms of diagnostics, you learn over a period of time how to do pattern recognition, and, you come up with a diagnosis and some differentials. Now, often that's a period of time. And imagine if AI can learn about an individual and could put a package together which could accelerate their learning. So the time point in the future where they become competent in a particular task possibly could be accelerated by AI. Now, we're maybe not quite there yet, but I know there are people talking in that area about actually looking about how we train and whether AI could. And we see that with student training all the time. Do you learn better with a lecture, a practical, a workshop, some directed study? And again, imagine if AI could look at student performance and could almost individualize a package that means we can deliver all practitioners to be competent quicker and therefore help with workforce shortages.
That's a fantastic and comprehensive answer. Thank you, Andrew. And there's a great follow-on question which has just appeared from Sarah. Christina, you're perfect to answer this. What current resources are available online for radiographers to educate themselves about AI?
Okay, so online resources will be available from the BIR very soon, and they're for the multidisciplinary team. I also believe that the resource that the ESR, the European Society of Radiology, with the help of the USOMI board, has put together is really phenomenal. And this is also available online. Obviously, all of these things, some of these things might require some registration, and there are some fees. Specifically addressed to radiographers, there is our course. I don't know if I can advertise that. This is not online, it's on site, but it's really fantastic because it's hands-on. And it has been running for 3 years in a row now, and we know it's very well. We have all the experts there coming and teach around the professional needs. So it's really customized for radiographers. Otherwise, there are many other data science courses out there, and some radiographers might have some affinity. They might have done a relevant degree before radiography. We do have some people who have done IT or computer science before radiography, and then they come into radiography. So it might be easier for them to follow. But I think the customization of the learning is important to understand the context within which AI is applied. So therefore, I would say courses that are customized for clinicians probably will be more amenable to radiographers. It's important to have these use cases that you mentioned, Hugh, to understand the context, because there will be different applications for pathologists, for people who might work with eye surgery, for people who work in other contexts. So I think it's important to go for a course that you will have the time and the space to discuss about the use cases of your own specialty.
Thank you. It's certainly a super exciting area with multiple opportunities and areas to learn, and hopefully we can share some of those resources after the webinar in the materials that will be released afterwards. One more question. I'll direct this to you, Andrew, from Dr. Anonymous, I'm going to call them. If AI is shown to be accurate in image interpretation, is there the potential to expand the use and scope of advanced practitioner radiographers? So radiographers with the support of AI providing an immediate result to the patient and then making an onward referral. Do we think we can get to that stage?
Yeah, and that's a really good point. I think what we've got to remember is, I guess, the current landscape, and I guess where I suppose radiographer reporting and advanced practice started and where it's gone to now. In studies, radiographers have performed, comparable to radiologists in many instances with the right training and the right focus. So I see AI as not, well, we don't need it because we're already doing a great job, which radiographers and radiologists are. Why would you not have a support tool available? I think we're all, widely aware that if somebody was to say, have you seen this? You would never look a gift horse in the mouth. And that's why, therefore, having this just to say, actually, yeah, I saw that, and that's the way I would have called it, it can never be a bad thing. But we've got to, also bear in mind that there are capacity issues, there are workforce issues. And if AI could speed up the radiographer, maybe undertaking some of these advanced practice roles safely and benefiting patient care, then that would be a good thing. And again, the governance side, that often some of these areas that radiographers are moving to are novel, and therefore there has to be appropriate governance. And if, supporting a radiographer with AI, providing that there's the evidence that this, works and is effective, again, I'm sure that would be a good thing, and it would have a benefit on patient care. So I think we do need the data, we do need the evidence. And I look today, and again, this is only one example. Well, there's 85 trials relating to AI in radiology currently registered, and that was only on one website. I'm sure there are much more. So the evidence is going to come. It's being collected, I guess, as we speak. We see examples within the literature all of the time. And I guess, for radiographers, we need to embrace this. If it gives us opportunities to advance our practice, why would we not? At the same time, advanced practice, there needs to be valid reasons for it. In the UK, it's grown because there were capacity issues. Again, the growth across Europe and wider will be because there is an unmet need. And if a radiographer, with or without AI, can help with that unmet need, then that's got to have a benefit for patients. So I think it will be supportive. I think, we've seen the energy that the radiology community have at the moment for AI. I was at ECR a couple of weeks ago, a great meeting, and the AI exhibition is almost like, for maybe 5 or 10 vendors previously to almost its own exhibition, which just shows that this there's real momentum, and this isn't something that is for research or maybe in the very specialist centres. These are going to be things that we're going to be using as part of routine practice. Even centres might say we already do, and that's great. But again, as a radiographer, if you are using these, you need to tell other people as well. The fear about, it's new technology, I don't understand. We need to hear about the case studies. We need to hear the experiences so that other radiographers can embrace the technology too.
Fantastic. And one last very quick but controversial question coming from Dr. Critical. One word answer potentially, Christina and Andrew. There's a video on YouTube from last year. Says, don't go into radiology. AI is taking over. Do we agree or do we disagree?
Christina, do you want to go first?
Yeah, of course. There was also another video in 2016 from another radiologist saying, stop training radiologists. I would say radiology and radiography are the most exciting areas to be in. And if someone doesn't go into radiology for that reason, but AI is there, it would be the same as asking someone to not travel by airplane because our pilots are using the autopilot so often. So I think it's just the best place to be. as front runners in this innovation. We get to experience things, we get to shape things, and I find it very enjoyable. I would say it's exactly the opposite. It's the best place to be if you are in radiology and radiography at the moment.
Yeah, I think I would agree as well. I think anyone going into radiography or radiology is going to be using AI tools quicker than they know. And I think other colleagues and specialities will be playing catch up and will be the forerunners. Well, we've hit the time. Thank you so much to the two expert panelists, Dr. Andrew England, Dr. Christina Malamatenyu, and I've been Dr. Hugh Harvey. And today's webinar has been sponsored by Cure and AIinHealth. This is part of a series of webinars exploring all of the issues around AI in healthcare. So please do watch out for future sessions. We're exploring other hot topics in the sector. So thank you so much. And please do reach out to the two panelists, follow them, read their research, and watch out for Christina's survey, which should be published soon.